Hi, I am Dr. Kayleigh McCollum. I am an audiologist at Johnson Audiology. I have been with Johnson Audiology for about 2 years now, and I do see a lot of our patients who experience tinnitus. I have a lot of experience with tinnitus because I actually have it myself, and I do treat my tinnitus with hearing aids and have been very successful. So I get a lot of reward from being able to help other individuals who experience that and help them manage it better. So the reason I like working with the tinnitus population so much is because I do think it's very underserved. A lot of individuals who experience tinnitus are told that there's nothing that we can do for it. Now, while there is no cure for tinnitus, there are different management strategies that have been proven to be very successful for a lot of individuals with tinnitus. And tinnitus is more prevalent than you would think. 10% of adults actually do experience tinnitus, which ends up being around 25 million people. So we want to make sure we're serving that population to the best of our abilities. So I guess the big question is, what is tinnitus? So tinnitus is actually typically a symptom or a function of there being damage to our hearing system, whether that be through hearing loss or other things that have happened in our life. Tinnitus can present itself. Now, tinnitus is one of those things that there is no objective way to measure it. It's a little bit different for everybody. No two tinnituses are the same, as I like to say. But the most widely accepted theory as to why tinnitus happens has to do with the overactive neurons firing within the inner ear system that our brain is then making sense of. And that's when we hear that trademark ring, roar, buzz, hum, or any other sort of kind of sound you can think of. So we've talked about what tinnitus is and what causes it, but let's talk about the things that we do to help manage it. Now, like I mentioned before, there is no cure for tinnitus, but there are things that we can do to help it be more manageable to where you can still enjoy the things that you do in your life and to be able to remain calm and relaxed. So treatment of tinnitus kind of depends based on what the results of your hearing test looks like. And whenever we find that, typically it's going to be a combination of sound therapy, relaxation exercises, and monitoring the triggers that cause our tinnitus to be worse. So one of the questions that I often get from patients is, how do hearing aids even help with tinnitus? And that's a great question. Hearing loss is typically the underlying cause to why that tinnitus is happening. So oftentimes by treating the hearing loss with wearing hearing aids, it helps treat the tinnitus itself as well. But on top of that, hearing aids have the capabilities that your audiologist can implement called sound therapy, where we put a masking strategy into the ears to help the brain kind of rewire its perception of the tinnitus to help it be more manageable. So maybe you have been experiencing tinnitus for as long as you can remember, and maybe this tinnitus has come up out of nowhere for you. The next step that I would recommend you take is that we do get a comprehensive hearing test. The reason we don't want to ignore tinnitus is it's typically a symptom of something else going on, like hearing loss. So we need to have that testing done so we can see what's going on, so we know what next steps we need to take. So if tinnitus is something that you are experiencing and you feel like is affecting you, please don't hesitate to reach out to an audiologist. I know that any one of us would be happy to help get you to a better management strategy of the tinnitus so you can go back to living your life the way that you want.